patients who have cancer. And I'm going to talk about the relationship between the mind, body, and self. So, self-concept is basically a collection of ideas and feelings of ourselves. So, the the mind part, the mind part, we, the mind part influences self-concept by how we see ourselves physically, how we feel about ourselves emotionally, and what we think other selves see ourselves socially. And the mind can greatly influence the self. And another thing that influences the self is the body, especially body image. And body image is basically our physical appearance, how we view our physical appearance, and how our body works. So if a person has cancer, automatically the cancer affects how the body works, and sometimes it can affect our physical appearance. So the view of physical appearance is distorted. And because the physical appearance is distorted, it can affect the mind. So the mind is changed because of our physical appearance. And because the mind is changed, our whole self-concept is changed. So with the person who has a changed self, they can either accept it or decline it. And if they decline it, that can lead to a distorted view of self-concept, which is not good. And so it is important to realize that the mind, body, and self is all interrelated. And we need to recognize people with cancer that the mind, body, and self affects how they see themselves.
Right, throughout our research, we found many articles, journal entries, personal statements, studies, and so forth that all kind of centered around this main theme that there is either a positive or negative correlation between mental and physical health. The best article that we found that best describes and most clearly explains what we're trying to talk about right now is an article that was submitted to the nursing standard by Michael Jackson, which was which he mostly explained in his article was he found research that helped support his personal experience in supporting his patients with chronic illness, mostly with cancer, in which he found a correlation that if his patients that were diagnosed with chronic illness were experiencing depression or anxiety or low self-esteem, he also saw an increase in fatigue or muscle soreness or weakness or vomiting or fainting spells and such physical things like that. And so it got us thinking that if there was a negative correlation between negative mental health and negative physical health, there must be a correlation between positive mental health and positive physical health.
Okay, so I had a question. Well, what I was thinking of is, can a patient consider themselves healthy despite their chronic illness, and particularly cancer? And there's a book by Donald Barr entitled "The Health Disparities in the United States," where he discusses these kind of two ways society views illness. And in the medical model, health is defined as the absence of illness, which makes a lot of us sick. You know, a lot of us have different illnesses. But there's other models, such as social and psychological models, that encompass more things, encompass both physical, emotional, mental health, and it allows the person to no longer be defined by just their illness. Because illness does take over such a big part of your life, but people still want to have those social roles that they have. They want to still be a mother and a father, and they want to still be a teacher, however they work or what they do. They want to not be defined by their illness. So health should probably be more defined as this, defining an individual should be able to define their health. It shouldn't be, we always have talked about it, your illness narrative. You should be able to tell your own story and let whatever you decide define you. So we have kind of been thinking that illness should be, health should be defined as a general well-being, and not just whatever your health is, just however your whole being is.
So I looked up Remission Society and how it affects the mental state of those who are in the Remission Society. And Arthur W. Frank, in the novel The Sociology of Health and Wellness, defined Remission Society as people who are well but will never be considered cured. And he kind of just said that those in the Remission Society struggle because they are always seen as sick. They are never seen as well. So, in the minds of many doctors, they will always be patients. And so, the Remission Society, though it can help because it's kind of a group of people who are all going through it, it can actually also hurt the mental state of those in the Remission Society because they feel like they are always sick and they will always be considered sick by those around them. So.
Also to go back to Donald Barr's article, the way that well-being is defined can have several different dimensions, such as the social level, which goes to more personal level, to the individual instead of a mass group, which takes into consideration their lifestyles along with how their illness may affect them, and also how there are different forms of well-being, such as the physical and the mental, and how there are different things that can help support the well-being of the different aspects of well-being, such as the mental and physical.
So, in closing for our group, as preventative care and newer cancer treatments arrive, survivorship increases exponentially. In a recent article in the Journal for Psychological Counseling, they talk about how this presents a clear and present need for different coping mechanisms and strategies. 86% of breast cancer survivors who have some kind of coping strategy, both while they were a patient and afterwards, reported having both better physical and mental awareness and state of being. With this, they also were able to transition from being a patient back to their old lifestyles much easier. And with that, I'd like to welcome up the next group.